Mr. Chairman, Mr. Secretary, it's always good to see you. Thanks for being here. The Federal Tax Refund Offset Program is a vital piece of the Child Support Enforcement Program. This offset program is when a non-custodial parent is due a refund but owes past child support. Treasury can withhold the tax refund and send it to the state child support agency to get it to the family so these children are properly supported. 60 tribes across the country provide and manage their own child support services, 10 alone in my home state of Oklahoma. Sadly, under current law, none of these tribes have direct access to the offset program. This means tribes are either forced to contract with states to get access to the program or forgo this vital program altogether for their families. This is devastating for thousands of tribal families across the U.S., and we must work together to grant tribal child support programs with direct access to the offset program. Mr. Secretary, the President's 2025 budget includes a proposed fix to this issue and provides tribes with access to the federal tax refund offset program. Do you have an estimation of how many tribes are currently forced to contract with states to get access to the offset program, and how many don't currently have access at all for their families?
Congressman, I don't have that with me, and I have a pile of papers, but I don't have that with me. But we could get back to you because you've touched on a very important issue.
Yeah, I thank you, and I appreciate it. You know, there's a lot of people depend on this, and having seen this early in my childhood, I think it's important that we have responsible parents, and being able to have that offset is really important. And so I look forward to working with you on that. And Mr. Secretary, healthcare treatments are rapidly changing and advancing at times, and federal healthcare programs fail to keep pace. I don't have to say this as a criticism, it's just a fact. An area that is proving worthy of further exploration and expansion is prescription digital therapeutics, which offer unique and promising ways to help cancer patients and those with behavioral health issues, key priorities of this administration and this Congress. Will you work with us to create a reimbursement mechanism so that we can ensure that Medicare beneficiaries have access to these treatments?
Congressman, we look forward to working with you.
Well, I appreciate that, because I think we all know that it's very important as we go forward in offering these services and being able to get it to our Medicare patients. Finally, one that's probably a little more touchy, that is on the hearts and minds of many people across America, not just in Congress, but certainly in the political world today, but it's because it's so important to the American people, and that's what's happening at our southern border. Public schools have been shut down to house illegal immigrants, hospitals have been financially ravaged, and the influx of fentanyl has killed hundreds of thousands of Americans and is not slowing down. This administration continues to either willfully ignore or hide from the public the true extent of how the crisis at the southern border is harming our country. Within the past year, I've been to Asia, Europe, and South America, and I've talked to every leader in those particular areas, including presidents and people from our own State Department. And there's not a fentanyl problem east and west of Mexico or south of Mexico. The fentanyl problem flows north out of Mexico into the United States across our southern border. And this problem is getting worse. The DEA has reported that sharp increase in fentanyl mixed with xylene is being trafficked into our country. This mixture is even deadlier than fentanyl alone, and even Narcan doesn't work to reverse the mixture's effects. It is now blatantly obvious that this drug is being weaponized against the American people. There's no other thought when you look at the cost per pill of roughly $1 to $2. Secretary Becerra, your department sees the damage that fentanyl has done to so many individuals that the world fentanyl is mentioned in President Biden's 2025 HHS budget a whopping one time. Even though this is clearly a public health emergency. Can you tell us how you expect to curb these fentanyl deaths and help with struggling addiction when the southern border continues to stay wide open and allow the free flow of fentanyl to our country? And I'll give you the balance of the time.
Congressman, thank you very much. I can tell you what we are doing, what the President has asked us to do, and the resources he's giving us at HHS on the healthcare side to deal with fentanyl. We are moving forward to try to make naloxone and other treatments that can counteract the effects of fentanyl overdose to keep a person alive more available. And today there are thousands more Americans who have access to the drugs they need to counteract a fentanyl overdose. We are continuing to make the types of services that work to keep people from dying available. So something as basic as a fentanyl strip, which lets someone know if they're addicted and they're about to shoot up, find out if that drug that they're about to ingest and put in their body is laced with fentanyl. That can save lots of lives.
Mr. Secretary, I have to take the last 9 seconds. I apologize.
Okay.
But wouldn't it be better if we just stopped the flow across the southern border instead of trying to find all these Band-Aids to fix the problem? That's all I'm saying.
Clearly
and it's flowing from Mexico clearly to the United States. I yield back, Mr.
And the
Chairman.
President has been doing quite a bit on that. Again, I spoke to you from the perspective of HHS.
Thank you. Appreciate it.